Right now, though, we've talked a lot the past few years about the pandemic and how it's hit our mental health pretty hard. Kids, adults, just about everyone. Dr. Michael Brodsky is the medical director for behavioral health and social services at LA Care Health Plan. Dr. Brodsky, thank you for being with us.
Thank you. I'm happy to be here, and thank you for covering this important topic.
Talk about it's easy for people to say, well, it's really hit us hard psychologically, but has it really? Or are people very resilient? And I'm thinking back, well, I don't remember it, of course, but the history of the Spanish flu. It came, it went, and people really did kind of forget about it. And they went on to the Roaring '20s. There was almost no mention of it in novels at the time, in journalism. People just wanted to be over with it, and they went on with their lives. Is it different now?
It may be a little bit early to tell whether we'll look back at this time at another set of Roaring '20s, the 2020s. Time will tell. But so far, we're seeing a few warning signs that it has been a bit of a rough period these 3 years. Kids and adults have been suffering. There's been a lot of loss. And we don't see a lot of signs that there's a rapid bounce back.
That's interesting that you say it that way, because 9/11 was an event that affected everyone who was alive at the time, and we all remember where we were when it happened. But this pandemic was a worldwide phenomenon. This affected everyone, and in an age of social media, and everyone could communicate with everyone else. But at the same time, there was also the rise of this misinformation and conspiracy theories about it, because anytime there's a major event, there are some people who just can't accept that it is what it is and have to create these narratives to make it more interesting to them. I guess I don't know how else to put it. So when we talk about we're going to tell our kids, we lived through the pandemic. This was a thing that shut down the world for quite a while, and it took us a long time to recover. So do you think it's interesting that we might have more cultural awareness of this because of the lingering after effects that we're feeling, for example, mental health?
I think that's absolutely right. And, it's interesting that you mentioned the kids, because if there's any single population where we're seeing the lights flashing the most red, it's with our kids. There's data coming out in the state of California looking at how the last year or so, or last year or two has been, and also most recently, just a couple weeks ago, from the National Centers for Disease Control in Atlanta, saying kids are having all-time high levels of distress, especially teenagers and especially teenage girls. This was a phenomenon that people were starting to note even before COVID came around in 2018, 2019. The mental health researchers were starting to note it. And, well, I'm sorry to say that we're seeing that continue.
Dr. Campen has a question.
So I'm definitely seeing a significant amount of young adults, teenagers, in the emergency department in mental health crisis, significantly more than I've ever seen in my career. And it's true, kids really bore the brunt of this pandemic with isolation, being out of school, and so forth. You're with LA Care Health Plan. What kinds of resources are being given to try to get on top of this?
Hey, Dr. Campen, thank you for the question. Not just at LA Care, but also at the state level. Governor Newsom and the administration made available $400 million to intervene for kids' mental health and substance abuse issues in the context of schools. So LA Care has been working for the past 15 months or so, and just earlier last month, we launched a telehealth program to provide counseling in the setting of schools in multiple school districts, starting with Compton Unified School District. We had a press conference, and we're very interested to try to get kids help sooner and in the place where they spend most of their waking time, in the schools.
Greg, I want to go back to you for a second. You have long COVID, do you?
I don't, fortunately enough.
Okay, but what about the psychological impact on you? Do you still feel that?
I'm happy to say no. I look at it every day. Obviously, I lost all my fingers on my right hand and half my fingers on my left, so it's a reminder every day of what I went through. I was probably one of the more severe people ever to have COVID that's still alive today. And fortunately enough, physically, outside of my fingers, I recovered 100% after even having complete organ failure.
How did you lose your fingers? What was the mechanics of that?
So I was put on pressors, which forces the blood to my vital organs for survival, which compromised my extremities. Fortunately enough, they were more interested in saving my life than fingers, which I think they made a great choice. And I'm alive to tell about it.
I do think that there are people who are listening who are going to hear your story, Greg, and think, how could it not have impacted him at a psychological and a deep psychological level, yet you say it hasn't now?
It's mindset. I've spent a large majority of my time helping others from, being the first patient that was admitted, educating people on understanding what the reality is. And I think a lot of my involvement in talking about it actually really calmed my mind in regards to being able to help others.
Dr. Brodsky, when we talk about the mental aspects of this and the long-term psychological effects, especially with the children who live through this, I think part of it might be, and you can tell me if I'm right, that the parents were just as frightened as the children, and children know this. A lot of times when children have lived through traumatic world events, the parents have maintained, a stoic outlook and tried to make sure that the kids felt like things were okay. But I think in this case, where the pandemic was first starting and we knew so little about it, and all we knew was that people were dying left and right, I think the parents were frightened too, and that has to filter down to the children, and that might result in long-term effects, right?
I could not agree more. That's absolutely true. I think if you recall back to 2020, there was fear in everybody's eyes and so much uncertainty about how things would play out.
All right, Dr. Brodsky, thank you so much for being with us on the show. Still in the studio with us, we are continuing with Dr. Angela Campen from Providence St. Joseph Medical Center in Burbank and COVID survivor Greg Garfield.